So my name's Christine Abrams. I'm a pelvic floor physical therapist.
I'm Dana Robbins. I'm also a physical therapist, and I am pregnant, but I am not a pelvic floor therapist. So I need to get some information and to learn a bit about pregnancy and what's going to happen throughout and after. So we're going to post up here and have some chats about pregnancy and pelvic floor and working out and what to do after to take care of our body.
And talk a lot about the information that we see on social media that sometimes can be really overwhelming, anxiety provoking. Who do I trust? Who do I listen to? And where to find good information.
There's so much out there. And I find myself like falling into that trap too, even though I feel like I should have that education.
Yeah.
Well, I do, but it gets overwhelming.
Right.
So the first trimester is a lot. Yeah. I feel like you take the test, and even if you're expecting it or not expecting it, I feel like it is a lot of emotions. It's very, very overwhelming. And then we were talking about this. You then call your OB right away. And they're like, okay, that's fun. That's cool news. We'll see you in like 6 to 8 weeks. And there's this dead zone of like, I feel like you just get so anxious. That's where a lot of people, including myself, tend to go towards social media.
Doom scroll.
And then these algorithms get you. Because I really tried to target who I was searching for, the information I was looking for, like research. But then the algorithm puts in those influencers in between and moms with experience, which definitely don't disregard them. But experience is not always that evidence-based research. And they're not telling you the why. I think the why is super important for people to figure out what to do next.
Yeah. And a lot of times with the momfluencers, they're an N of one. They have their own experience, but they can't give you the scientific, evidence-based, thing that's going to back that up.
Yep.
And in the first trimester, when you're so early that you haven't even seen your doctor yet, you're not telling your best friend, you're not telling your mom, you're not telling those trusted people in your life. And so you're just stuck in the little social media spiral of, what can I learn without really going to the people that I know and trust or my medical provider yet. Right. It's too soon to talk to your GYN about it.
It can be a bad place. And there was a time where my husband was like, stop. He's like, get off of it.
Put the
phone down. I'm like, okay, well, this girl, she had these symptoms and this one. And there was not one person I found on social media that talked about their symptoms in the first trimester that I have had the same symptoms. Right. And I don't even want to say what my symptoms are on here because everyone is so different. And there was a point where I was sitting there and just waiting for these symptoms to come on. And so then I got anxious about it. I'm like, why am I don't even know what's going to happen.
And so much of prenatal times is mom sharing, battle stories of, oh, well, I remember when I was pregnant and this is what happened to me. And, it's rare that they're like, guess what? Pregnancy is going to be tough sometimes. It's going to be great other times and you're going to get there. Yeah. We're not really having that conversation very much.
Sure. So, definitely. Yeah. So I think when people go on social media, what are the types of people they should look for? What credentials, what evidence-based things should they at least start with? And then maybe you can go into the opinion-based things or at least get that grounding of, okay, this is what is normal. This is what evidence showing. This is when a red flag, and maybe I should give my doctor a call.
Yeah. Well, of course, as two physical therapists sitting here, our bias is, of course, to think that we're the best, and we are. But so looking for anybody who has their physical therapy degree that is also a pelvic floor physical therapist, as that field is becoming more trendy, and we're hearing and seeing a lot more of it. As in any profession, not everyone is created equally. And so looking to see for people who are not trying to sell you something. They're not trying to feed you fear to keep you hooked. And people who can cite their sources or show people that they've worked with who have had success, things like that. Some of the OBGYNs, I think those are really good people to follow because you can see and hear their perspectives before talking to your own.
Right.
But at the end of the day, of course, always talk to your doctor and see what they have to say about you.
I think
people you've liked.
Just checking people's credentials for sure. Like you said, I'm definitely biased to physical therapists and pelvic floor therapists. As a healthcare provider, I've really liked social media because I've gotten to see perspectives from other healthcare providers, like doctors, like OBs, that I never would have known before because they wouldn't be posting on anything, or I would have had to like search for their research paper or whatever it was. So that's a big one. I also, hopefully you're not diving too much deeply into like the world of baby products yet, because that is a whole, oh my gosh, that's a whole other world of anxiety. But finding like feeding therapists, occupational therapists, speech language pathologists, anyone with like lactation consultant, which that can really be anyone. A lot of nurses get that certification. A lot of OTs and SLPs do as well. So I think that's a whole bunch of group I have also been looking towards. And I think it's important to note, not to downplay or disregard a certification, but to also check people's education levels, because that is different. That makes a difference, compared to a certification versus maybe they are an RN versus a speech language pathologist. I mean, we really understand their background education. They know so much about up here. They know so much about cognitive things. So that is a huge thing. Just look at credentials. And if you aren't really sure, and they should have them listed like loud and proud, because like I know we worked hard for them. So they should be up there. But definitely like the selling thing. If anyone's selling anything, I'm usually a little like, I don't know. I'm towards the end of my first trimester, almost in my second. But when would I want to come and see a pelvic floor physical therapist? And what should I not be doing during my first trimester?
Great questions. So typically for pelvic floor PT, we don't do any internal examination until someone's in their second trimester, just to kind of keep everything safe and sound. The first trimester is such a tenuous time. But the thing that I always tell people is, if they feel concerned at all about, is it okay to ever do internal work during a pregnancy? Really the only time that would be a limiting factor is if your doctor told you that you're on pelvic rest for any reason. That might be due to the position of the placenta or any issues with the cervix, stuff like that. But your GYN would let you know if you were on pelvic rest, in which case they would limit your high impact activities. They would tell you that it's not safe to have sex, and then just to avoid any kind of penetrative activities, including physical therapy. So in the absence of something like that, you're safe to get pelvic PT starting in the second trimester. Every now and then someone comes to me in the first and we just skip the internal portion of things. There's plenty that we can do externally, even just starting with education of what is the pelvic floor? How do these muscles work? What are their jobs? What should I be thinking about during my pregnancy? And one of the first questions that everybody comes and asks me when they find out that they're pregnant, even if they can't see me yet, is, should I start doing Kegels now? And the answer is always, it depends, because I can't magically see what's going on without touching anybody. But what I'll say is probably 8 out of 10 times in pregnancy, Kegels are not the answer, because these pelvic floor muscles work really, really hard. They're working overtime for 9 long months. And so they're already trying to strengthen and support just by the natural changes that happen in our body. And what I see happen that provokes some of the pains that we hear about in pregnancy, pubic symphysis pain with intercourse, SI joint pain, those are all really rooted in pelvic floor tension. And so if we're doing Kegels and trying to over strengthen a muscle, that can promote that cycle of tension.
It's just an endless cycle then.
Yes, exactly.
That's not fun. I was very surprised in how much change I felt in my body during that first trimester, because it's like you don't see a bump. I like barely have anything right now. But there's like, I feel like no one ever explained this to me, and hopefully I can explain it for someone else, but there's like a tightness here. And the best way I can explain that is, so I teach a lot of Pilates classes. I do a lot of cat-cows, okay? Whenever I drop down into a cow, I cannot get anywhere near my range of motion. And it's tight and it's weird, and it's like, I was not expecting that. But I've already felt those changes throughout that first, and I wasn't expecting that. I thought it would only start to happen when my bumps started to show. I mean, it makes sense. Changes are happening in my body, but it's hard to figure out because it's not, you don't see it externally. But there are a lot of things. And then like urinary frequency is crazy during that first trimester. And so to know that it's not because of anything with the pelvic floor, it's more blood flow, it's that pressure being pushed from that growing uterus. So that the pelvic floor is really not going to resolve that issue right then and there.
Yeah, exactly. And that's one of those things too that we want to keep from being a runaway train. We don't want the frequency to start in the first trimester and then just get out of control when everyone says, oh, you're just pregnant, you're gonna have to pee all the time. You know, we want to make sure that that doesn't get out of control. But particularly in the first trimester, like you said, increased blood flow, more pressure, uterus going from the size of a fist. That's where we start from. And then by the end of pregnancy, it's the size of a watermelon. So, you know, we see a lot of that. So have you felt any round ligament pain starting at all?
Yes. Is it normal to have it more on one side than the other?
It can be.
Okay.
Yeah.
I've definitely like more in the past like weekish or so been feeling a little more on my right. I did have an ultrasound recently, and I don't know if this has any effect, but baby's head was down towards the right. So I wonder if I don't know if any more extra pressure is being placed because its head's still so big.
So
I don't know.
And so the round ligament is that ligament that anchors the uterus to the inner abdominal wall, and then that stretches as, you know, the uterus grows and we become more pregnant. And so people can feel that like rubber band, snappy pain, kind of lower abdomen, either on one side or both. They usually feel it when flipping over side to side or changing positions quickly.
So it's just kind of attaching that whole uterus that's slowly getting a watermelon size.
Yep, you got it.
So it doesn't like fall off of the wall.
Yeah, pretty much. Not floating around in there.
So definitely some pain I could see. Is there a treatment for that, or is that something like you kind of have to get through?
There are treatments for that for sure. So treating the abdominal wall in pelvic PT, there's fascial techniques that you can use to release that ligament, which are pretty gentle, all things considered. And so really that should not be an ache or pain that you deal with a lot during pregnancy. If it happens here or there, you know, we can consider that, you know, normal-ish, right? We always talk about common versus normal. It's very common to deal with, you know, urinary incontinence during pregnancy, but is that normal? No. Whereas round ligament pain, that's very common to deal with, and a little bit here or there I would consider normal. That's a growth pattern that we go through, but to really have that be limiting you, that's not normal. So that should be treated. And I think that's really where, that's a cool place where pelvic PT comes into pregnancy is, you know, we hear about all these, like you said, the scary things that we hear are, you know, leaking, diastasis, coning, prolapse, all of the scary, scary things. And any of these, or even just like back pain, SI joint pain, pubic pain, the pregnancy is so tough, it's so painful. There's so many ways to manage those symptoms, not only to give you a more comfortable pregnancy in the first place, but make your postpartum even better. And so
that's a huge thing.
You got it.
Because it becomes, oh, well, I had a baby, they ruined my body type thing. But it's like, no, that doesn't need to be the case.
And our bodies are so resilient. And I think that's what we don't hear on social media when we're being sold fear. It's, you know, we're really good at doing this. We've been doing it for a long, long, long time. And our bodies want to do this well. They want to get better afterwards. And we just need to keep nudging them in the right direction and support that growth.
For sure.
You know, and so I think that's where a good team of, you know, a pelvic PT, you know, a GYN that you really trust, a trainer at the gym who knows what they're doing, you know, all, like a great team goes such a long way.
Definitely does. I think on the note of that, unfortunately, my first prenatal visit was not a great one. So I always encourage people to find someone that is good. Don't feel like you're stuck. And you know, it's okay if that's more than one. It's okay if that's more than two. Make sure it's someone you trust. Make sure it's someone that is giving you information that makes sense. And that you feel comfortable with and you can talk to and listens to you. That is a huge, huge, huge thing.
I've had people change GYNs at 35 weeks. I've had people wait, you know, not wait, but, you know, final straw. They're like, I can't do this anymore. So it's never too early. It's never too late. And having that communicative relationship where they understand what your goals are, what's important to you, and, you know, have a conversation with you, help you understand why. That's so important.
The why. And talking with you, not at you. Not just giving the same spiel they've probably given every day for the past like 20 years. But like making sure you understand it. And educating you through it.
So what was a problem with your visit? What were some things that you needed more info on?
So a big thing was genetic testing. I think that's it's a newer, I don't know when really it started more so with the blood testing of genetic testing. We weren't really educated on it much before going into that visit. And then all providers are mandated to ask you if you want it, and it's a yes or no. At least from what I understood, it was a yes or no then and there. There's a lot to it. This is a genetic testing. It's usually a blood test, either you, maybe your partner as well, to screen the baby for possibilities of genetic anomalies like cystic fibrosis, I believe muscular dystrophy, things like Down syndrome. There's a whole list. And I think that's an important conversation to have with your partner to understand, okay, do we want to know this? Do we not? What are the benefits? If I do know this, what about if I don't know this? And
that's a conversation you would want to have with your partner.
Exactly.
Instead of, you know,
right in the office when it's like, okay, yes or no. And I'm like, whoa, wait a second.
I need to think about this.
Like there's a lot. And like, I'm also a why person. I need to know the why. So I think that's maybe my just personal problem and preference to be like, okay, well, what is the risk of this? And why, if I know this, how are you going to help me get through that? It's just I don't think there's not a right or wrong answer. But it's a discussion that I think should be had privately with your partner before going in. And also, not all insurances cover all of it. So that's, of course, financial is a huge thing. So that was one thing. Another thing, my provider just spoke very, very quickly. Like I mentioned, she kind of spoke at me, and she was speaking at me while my physical exam was being performed. So that was a bit overwhelming. I felt like I didn't actually comprehend or take in a lot of things she was saying.
I always joke with people, I'm going to explain everything to you once while your clothes are on.
And
I'm going to explain it all over again while we're doing everything, and you're going to know exactly what's happening before I do it.
That's great. So, I love that. I treat a lot of vestibular patients. So it's the same thing whenever I go to do like an Epley maneuver. I'm like, okay, I'm going to talk you through it. I'm going to show you it. And then we're going to go through it. Because it's like just that knowing of why, and like, for sure. That was a huge thing. And then unfortunately there was some information that I didn't agree with that she gave me. And I think just with my background in the education that I have, I was able to pick up on that. So that was frustrating to me as a provider to hear this information from her that wasn't really up to date with evidence out there. And it was frustrating that someone that might not have like the same background as me to understand, wait a second, that's actually, I don't know if that's entirely correct. But my new provider, I'm great with. I kind of went over everything I questioned with my first provider, and we're all good. And now I got someone like you on my team as well. So it'll definitely be a great team.
But like you were saying about the positions of not being allowed to lay on your back at all, even for a moment, or get your heart rate above a certain level. You know, while everything needs to be taken with a grain of salt. And do we want you to lay on your back for 24 hours a day? Of course not. Do we want you to get your heart rate to 200? Of course not. But, you know, when we put the seed of fear in people, and they're worried that if I'm active, I'm going to damage something with myself or the baby, and then they become more sedentary, then they have more aches and pains, then they can do less, and their postpartum is harder, then they don't do as well in labor and delivery because they don't have the endurance or strength for it. And it's this cascade that happens. And truly, I'm such a huge believer, and I see this every day in my practice, the more active you are in your pregnancy, the better your labor and delivery is going to be, the better your postpartum is going to be. And that doesn't mean that you have to do CrossFit, but guess what? You can if you want to. I have plenty of people who do. That might mean that you go for a walk, 5 days a week, and you do some body weight movements. that's enough, you know, and it's all dependent on really what your goals are, what do you want to be able to do, and what is your baseline. And someone like you that has a really high baseline of teaching exercise classes multiple days a week, you know, we always have to take the individual in front of us into account and not just say, well, this is what my textbook taught me 30 years ago.
Exactly.
And I haven't read a research article since.
And that was a huge thing because she told me that I can't lay on my back after 12 weeks, and that's a hard no. And I was like, okay. And that's not realistic for me.
Right.
That's not, I wouldn't be able to quit my job. I own my own business on top of that. So like, that's just not going to be an option for me. So, and in regards to the laying on the back, let's talk about like the why people have said not to lay on your back. And the biggest reason is it's more so going to hurt. I don't want to say hurt. Hurt's a bad word.
Yeah.
It's more so going to affect you and not the baby. But it's the baby putting pressure on some blood vessels down near your groin area. And this is why it usually happens more so when we're bigger. There's more baby, more pressure. And some other providers and research out there really don't have a set date. They're like, nope, at 12 weeks, you can't lay on your back. At 30 weeks, you can't lay on your back. It's always going to be comfort. Your body's going to tell you when you need to move. As long as you are, especially sleeping. My provider told me, my new provider told me, she said, if you are only able to sleep at like 30 weeks pregnant or whatever on your back, sleep on your back, maybe a little modified position. And your body's not going to suffer through that position if it can't be there any longer. I know when I was teaching some group fitness classes at some other gyms, a lot of pregnant ladies came in and they were still working out, awesome for them, but they would completely avoid bridges. They would completely avoid bench pressing, anything like that. And obviously it's within your comfort, it's your discussion with your doctor, but it's not a hard no.
And usually what I wind up seeing is once people wind up getting to 30 weeks plus, then they're just like, oh, this feels like too much pressure. I'm not into it anymore. And that's fine. And then that's their choice, and that's them, their body feeling when it's time. You know, they'll just feel like, can't take a deep breath like this anymore. And that's different than saying, I'm going to take this entire plane of movement off the table for you. And I hate the phrase hard no. Unless someone is, you know, about to drive their car off a cliff. Like why are we saying hard no? You know, so it's just yikes.
And that was the thing that's frustrating is like, I went and scoured the internet after it and with research. I was like, is there like, am I doing something wrong? And there's no solid evidence to support that. The like 12-week deadline. And same thing in regards to heart rate and working out. You know, you always do what you can do, especially first trimester. If you're nauseous, you're also extremely tired. So you're going to listen to your body, but know that you really don't have, unless they have been set by your doctor, you don't have huge limits. It's not like, don't let your heart rate spike past 130. It's like, you can walk up and down the stairs and it could get there. So how is that realistic?
Yeah. And I think too, that's, you know, I always say to people, pregnancy is not the time to PR. And
for sure,
our goal during pregnancy should be to remain active as long as possible. I always say to people, weeks 0 through 35 is all about strength, stability, activity. Weeks 36 through 40, that's when we switch gears into stretching, rest, relaxation, opening the pelvis, letting all of these things happen, nourishment, you know, and all of that. So up until week 35 though, we got to keep you moving. Because that's going to keep you pain-free as long as possible. And, you know, with that being the goal, then, you know, the mindset shifts a little bit. We're not worried about, you know, getting the best ride on Peloton or, you know, hitting a new PR at the gym when we're pregnant. The goal should be, I want to have a really solid labor and delivery. I want to be ready for postpartum. I want to be ready to play with my kid and pick them up when they go from 7 beautiful pounds to 70 pounds. So... And
if you have another child at home waiting for you.
You got it.
That's a huge thing too.
For sure.